So it's my great pleasure to welcome you all to the FT Future of Health coverage at this wonderful Royal Tropical Institute. An ambition like Health for All very much speaks to our purpose and values as a leading global news organization and the contribution that we can make to society.
I encourage you to capitalize on that technology so that good health and well-being are accessible to everyone. I'm very happy to be attending this event because this is actually why I do what I do. So that through financial inclusion, we can deliver what really matters, that is, opportunities, protection, and health.
35 to 40% of GDP is run through this. Can you believe this? In a couple of years, 35 to 40%. And people that had no access before, suddenly they are part of the financial system.
By 2023, we want to see 1 billion more people benefiting from universal health coverage, 1 billion more people better protected from health emergencies, and 1 billion more people enjoying better health and well-being.
Technology also needs to be an empowerment tool, particularly when it comes to knowing your rights, exercising your rights, when it comes to access to care, health care, and knowing when you receive quality care.
If I would start all over again, I would throw away all these electronic health record systems and start with a mobile solution, which is patient-owned.
We need to start to rethink current legal regulations in the way our data is handled, and that's really important.
And in economics, we think about this game as having two equilibria. There's a good equilibria, that everybody participates and everybody benefits. And there's a bad equilibria, where nobody participates and nobody benefits. And there's nothing in the middle. It's not a stable solution that half the people participate and half the people don't.
I think healthcare in Africa is eminently investable. And eventually, more avarice financial investors will figure that out as well.
The economics of not spending money on this don't make any sense. These diseases are formidable adversaries, they'll get worse, not better. And secondly, from a global health security point of view, you're not doing yourself any favors not dealing with these diseases.
Health is wealth. As the saying goes, in a healthy nation is a wealthy nation, everybody says. But not much effort is made to make it come true.
How many African countries have tried to think through social health insurance and have been discouraged by the donors very deliberately and very directly that don't try it, this, you're not ready for it?
It's not about more money. The money is already there. A lot of it is fragmented and paid in silos, and a lot is paid post-paid. So it's inefficient.
The degree of progress that's been achieved over the last 10 or 20 years, I think people really have recognized global health as an area of progress that in many cases is unprecedented in human history.
It's important for ministers of finance to think about creating that reliable, regular source of income to support universal healthcare.
By providing people with this tool in their hand and providing that information in a bite-sized way that can be understood and that is also personalized, it's in the local language, and it also takes into account all the other factors about how you live your life.
Keep speaking to the value, the shared responsibility we have, and that yes, it does take a bit of money from our pockets, but we need to be able to be part of that transformative agenda, because ultimately it's the world's poor that need to be lifted out of poverty, and it's actually a very small piece of our very generous pie at the end of the day.
I think that the future of healthcare is mobile, and from the very important conversations we've had today, it really shows that the future is going to be very disruptive and different.